You're listening to the Sick and Good podcast. My name is Dustin Messick. I'm a registered dietitian nutritionist and a cancer survivor.
My name is Colin Goodwin. I'm a clinical psychologist and a cancer survivor.
In 2024, we are highlighting the Cancer Awareness Month in a special series.
We're promoting wellness by having discussions on screening, treatment, and recovery throughout the cancer journey.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen.
October is Liver Cancer Awareness Month, and we're happy to be speaking with Sarah Maines for this episode. Sarah is the Liver Cancers Program Director at the Global Liver Institute. She brings nearly 20 years of experience serving the oncology nonprofit community, with a particular focus on oncology program development, health equity, and patient advocacy. Welcome, Sarah.
Thanks for having me today.
Can you tell us a little bit about how you got involved in the Global Liver Institute?
Absolutely. So I joined Global Liver Institute, or as we often refer to it as GLI, almost 3 years ago now. For the last 20 years, like you mentioned, Colin, I've been in the liver patient advocacy and liver nonprofit space. Cancer nonprofit space specifically for the last 20 years, but have been really excited to solely focus in the liver cancer and liver health space for the last 3 years since joining GLI. But patient advocacy has been something that's been very important to me for the last 20 years, and making sure that we can really meet the needs of our community, whether that's the patient or caregiver or healthcare workers, to really make sure that people don't feel isolated with whatever their condition or diagnosis might be.
I was going to ask you, what does that advocacy look like within your current role?
Absolutely. So when I think about advocacy overall, and even kind of taking a look at the last 20 years of my profession on what is medical nonprofit organization, what does that look like? And I oftentimes talk about how patients, or, even before diagnosis, kind of assume and think about that process of you go to the hospital or you go to a clinic, a doctor's visit, and they tell you what to do. And there's medication to take. There might be surgery, all of these steps that your nurses and doctors and pathologists might suggest. And there's always more to that. There's questions on what else, or did I hear them say the right things in my doctor's office, or I don't understand that word. How can I help myself? How do my loved ones and caregivers understand, my employers? That there's oftentimes a lot of questions and other needs that people need to get. And that's really kind of the best way for me to describe what advocacy looks like. What brings a sense of comfort or trust or education that can bring information or kind of lessen some stress for individuals. So when I think about advocacy that way, on how do we deliver that preparation and education, oftentimes it looks at how we can simplify explaining what's happening. Oftentimes now we'll call that health literacy. How do we make sure that people are kind of grasping and swallowing education in a way that makes sense to them? And equally, what is the responsibility of our healthcare staff on using words that make sense, that are meeting their patients where they're at? So that truly is one of the areas to me that we can do our best job on simplifying language, being able to take complex words and definitions and speak to kind of a general audience, if you will. That's something that GLI does a lot of with our resources, whether it's in different languages. How do we write education in a way that someone who has very little knowledge can understand it, and a patient that knows almost just as much as their healthcare team does, and everything in between, but also those learner styles that we know Do we need them in video form? Do they need to be really fast, bite-sized, short pieces to keep up kind of with our social media attention? Is it done in a podcast form? Really reaching out and meeting people where they're at to get that education out there.
What are the current prevalence rates for liver cancer?
So liver cancer is a cancer that I feel is not talked about enough. It needs to be in the forefront. It's an area with liver health that we're seeing is becoming an epidemic. And when we look at liver cancer statistics worldwide, liver cancer is the 6th most common cancer diagnosis that is being given. It's also the 3rd deadliest cancer. The rates are really, really hard. One of the things with prevalence for cancer rates that we talk about is the fact that symptoms are hard to come by. Liver is unique that pain receptors are not present in the liver. So, other people might feel tenderness or a lump from a tumor and have different side effects. Liver cancer, not the case at all. So one of the other statistics that we look at, the World Health Organization, WHO, talks about by 2040, there will be 1.4 million new cases of liver cancer, 1.3 million deaths. So you can see that morbidity rate is really, really high when it comes to liver cancer. And the amazing thing, too, is 70% of liver cancer diagnoses are actually preventable. So there's a lot that we can do for ourselves to make sure that those cases aren't high and that morbidity rate doesn't have to be that high.
What are the causes and risk factors associated with liver cancer?
So when we talk about risk factors, oftentimes, and I should mention, for liver cancer, the most common type of liver cancer is hepatocellular carcinoma, or HCC. 75 to 80% of liver cancer cases are HCC. Equally, another liver cancer diagnosis is called cholangiocarcinoma. Cholangiocarcinoma is represented about 10 to 15% of all liver cancer cases. So when, we look at kind of what are key risk factors, first of all, men over the age of 60. We also look at individuals that have chronic liver disease. If someone has an advanced or chronic liver disease, they have a 40 to 60% likelihood of that developing into liver cancer. When we also look at risk factors related to hepatitis B or hepatitis C, what does that look like? What are our responsibilities to take care of our liver health through hepatitis and lifestyle? Not sharing needles, making sure that risk infection areas are lower, making sure that we're compliant to medication if you are diagnosed with hepatitis B or C. What are we following for medication and treatment? But also things, such as high alcohol consumption. How does that affect, our liver processes toxins? We all know. I think people are quick to assume and quick to jump on any type of liver disease is stigma. They must be a drinker. They must have alcoholism. What's going on with alcohol abuse? And that truly isn't the fact. It definitely can contribute from a risk factor, but also us talking about metabolic health. So how do we look at obesity? How do we, look at heart disease, diabetes, kind of all of those things that we know about having a healthy lifestyle also contribute if it's not healthy from a liver health standpoint.
And can you speak to symptoms that you look for?
Yes. So symptoms, that goes back to, when we talk about the liver being a super unique organ. First of all, I think talking about liver as a whole, liver is an incredible organ. Of course, everyone at Global Liver Institute and in the liver world gets very excited to talk about all things liver. But I kind of want to go back because when the basic assumption, people talk a lot about heart health being super important, and you can't live without a heart, and you absolutely can't. You need that blood flowing in the heartbeat, but equally you can't live without your liver. So if we, before we start talking about symptoms, if we talk about the liver being the second largest organ in the human body after our skin, what does it do? It's a large organ. It's a football sized organ, kind of below your diaphragm or above your stomach. And it has over 500 functions. So it's a very, very complex organ and very, very important. So we first of all talk about like, what does liver do in our body, such as processing or storing nutrients? What are we eating? What are we drinking? How does that affect our liver and what it does? Because it removes waste and toxins from our blood. Like that's a big part of that cycling through our liver to eliminate toxins and waste and removing chemicals. But also it's a huge part of our blood system. So whether that's platelet, helping with coagulation and stopping bleeding, maintaining the blood's volume, it also produces bile to help with digestion. So complex. So then when we look at symptoms, if someone is saying like, I am at high risk and I have certain family genetic factors or lifestyle factors that are contributing, since there aren't pain receptors in the liver, that's not the easiest way to detect. When you have advanced liver disease or an advanced cancer diagnosis, you're going to start feeling pain because the likelihood of it having spread outside of that organ is where that pain's coming in. We will have patients, though, say that they might have some stomach pain. There's a large weight loss that they're seeing that's contributing to eating and how nutrients are being taken in. And, what does loss of appetite look like? And then jaundice. That's a very typical response to liver health or poor liver health. Jaundice is the yellowing of the skin or the yellowing of the whites of your eyes. That oftentimes can really trigger people into thinking like, hey, something's going on, whether you're noticing looking at yourself in the mirror or a loved one is like, hey, your eyes look a little different. Some people know with symptoms too that they might have white stools or bowel movements, looking at ways that nutrients are being passed through your body and processed. And then oftentimes, feelings of bloating, weakness, fatigue, fever, nausea, kind of those telltale signs when people are like, something isn't going on and I think I need to take a look and go to my doctor.
Just thinking that like, if you find yourself turning into a Simpsons character, then that's maybe a good time that you need to be seeing your doctor, right?
Absolutely. I was going to say with the doctor team, Colin, if you don't mind me, talking about with the liver being such a complex organ, oftentimes for symptom management and when patients go in and are taking a look at their liver health, the multidisciplinary team, which is essentially defined at the whole huge team of people that take care of patients and kind of that intersection of roles and responsibilities. We talk a lot about the multidisciplinary team with liver care. Because oftentimes, whether it's a liver disease like fatty liver or NASH MASH, alcohol-related liver disease, a pediatric or rare liver disease, is first detected if you go to your primary care physician or go to GI doctor. Hepatologists, which are doctors that study and help the liver, is less known, or there's not a lot of hepatologists out there in this field. And so we talk a lot about the incidence rate on it being detected oftentimes falls into pathology, oncology, GI specialists. What's the responsibility of a primary care doc or a generalist finding this, and also making sure that the healthcare professionals, HCPs as we refer to them, are also aware of liver health and are kind of being able to detect symptoms and what that means to help patients. So that's a big part of patients' care too, is just navigating that multidisciplinary team.
And can you tell us a little bit about like that screening process to like detect the presence of the liver cancer?
Absolutely. So, the screening process is usually something that's done to find the disease early in people that are at most risk, at people who are at most risk. So, when diagnosed at an early stage, liver cancer can be very effectively treated. And majority of screening is going to come through imaging and imaging tests that way. We also know that some screening can be done through liver levels, having a liver panel, LFT, seeing, what are different rates, what is your blood looking at and detecting. And so I do tell patients, if they are in an at-risk category, so a male over 60, the prevalence of liver disease being found in Hispanic or Latinx populations are quite high, along with Asian AIPI populations. How do we make sure that if people have risk factors that get them higher, that they're kind of taking their health into their own hands and going in and talking to their doctors about this? So asking for an LFT liver blood test, looking at imaging if that's an issue that they're concerned about, and working with your provider. So many healthcare systems have different imaging systems that they can provide. So really asking those questions and seeing what are you able to offer me to take a look at my liver and to see how I'm doing, if I'm healthy. And then also going back to that hepatitis. Are we vaccinated with hepatitis? Are we compliant with treatment if we do have a hepatitis diagnosis? And how do we really support long-term liver health from that?
What are some common and novel treatment options?
So treatment, the biggest thing in terms of treatment oftentimes will come down to resection or liver transplant. If our liver is too diseased, the ability to help with the current state, especially if there's cirrhosis or scarring tissue of a sick or unhealthy liver, would not respond well to chemo and radiation right there. Very advanced liver cancers, it comes down to transplant. I think one of the kind of neat things about liver in general is regeneration. The liver is the only organ that can regenerate. So if there is resection and your liver is able to grow back, it's able to do that and go back to original size. When we also talk about liver transplant, we can have a deceased person donate their organ for a patient who needs a new liver, but you can also donate a liver. We've worked with many people who have said, my sibling, my friend, a stranger gave me 49% of their liver, and that person's liver is going to grow back, and the patient's liver will also, their new liver that they receive will grow back. But we also, separate to the transplant or resection, immunotherapy is super important. What do clinical trials look like? Clinical trials help us in such a big way to advance drugs and treatment that we're looking into, helping the patient population more. And the targeted drug therapy is a really huge thing in the liver cancer world.
That's really fascinating that you could give essentially 50% of your liver to somebody else, and then your liver will grow back, and then their liver that you gave them will grow back.
Yes. It's fascinating. And when you think about patient sizes, obviously that does, fall under making sure that the donor is within range, but we'll oftentimes have patients that are of smaller stature that receive a liver donation from someone who's much larger, and also for that person's body to kind of like reacclimate and have that liver grow into the size that it needs into your body. It's a very, very cool organ.
Yeah, I wish more organs were like the liver, just grow back.
I know.
What are some of the nutrition related recommendations for this condition?
So when we talk about liver health in general, liver is a metabolic organ. We're hearing a lot about the GLP-1 drugs that help with weight loss. We notice a correlation of a weight decrease to help people with liver disease. Oftentimes you hear people say like a 10% weight loss can be a really, really great thing to the general public overall. But when we do think about healthy eating with liver, it goes back to us really watching processed foods and ultra processed foods on making sure that we're either very much decreasing that or eliminating that from the patient's diet. These are all things from a prevention standpoint that someone that doesn't maybe have risk factors, what can they do to also make sure that their liver stays really healthy? So it's increasing fruits and veggies, also making sure that those fruits and vegetables are really bright colors, that the vegetables are your dark leafy greens, and just those vibrant colors are going to fare well in our body. We also, when we think about antioxidants, there have been some studies on, eating a handful of grapes or dark cherries, how beneficial that is. But that really just goes back to this colorful diet, making sure that we're hydrating well. There is something called aflatoxins, and that can be a risk factor for some people for liver disease or liver cancer. And aflatoxin is essentially grains or nuts that are old, essentially. If we reduce our aflatoxin exposure, we want to make sure that like nuts or grains are not moldy, especially peanuts. And so when we think about that too, it just really goes back to consuming whole foods to make our body extra healthy and work really well. There's a very fun fact that we love for all the coffee drinkers that might be listening today is drinking coffee in just 2 to 3 cups a day, unsweetened coffee. So we don't want it to taste like dessert, but there's almost a 40% reduction of liver cancer and nearly a 50% reduction in liver disease deaths. It really helps, with our liver enzymes, drinking coffee, the way that our liver filters out. It's an incredible kind of super food that we talk about, the power of drinking coffee and how important that is. So patients after a cancer diagnosis, that's something certainly that we talk to them about too.
One might even call that a perk.
I'd say it's the health drink to start off your day.
Well, just pun intended, there's both of that percolation with the coffee and the filtration of the liver. Wanted to ask if you could just speak to some health disparities in the treatment for this patient population.
So my work with GLI, we talk a lot about health equity and health disparities because the incident rate is higher in Hispanic, Latinx, Asian, Black African population. The disparities that come along with that, I'm glad that this has been an area that is being talked about more. One of the crucial and critical things that we look at is rural healthcare. How do we make sure, when I spoke earlier, that hepatology, the hepatologists that are out there aren't a ton in the hepatology field. How do we make sure that patients have access for care? How do we make sure that screening is available, whether a patient is at high risk or is experiencing some symptoms? How do we make sure that they're finding that person or hospital clinic that can truly help them? So we talk about rural health a lot. Health advocacy and patient advocacy play into that, making sure that information is at people's fingertips, that they can kind of navigate and take their health into their own hands if they need to. One of the other, disparities when we look at is, the financial burden overall in oncology for the last 20 years. I've talked about that. Like, what is that financial toxicity, the impact of very frequent treatments, surgeries, long-term care, survivorship needs? How does that impact? And then back to it being, from a health equity standpoint, a very diverse ethnic population of people that are affected by liver disease and liver cancer. What is our responsibility to help immigrants and refugees? What does that look like from a medical system of making sure that we're reaching out to individuals, if there's translations, if there's interpreters that can help them, if there's general education that we can give through hepatitis vaccinations, like really trying to get to patients before that diagnosis is given to help health disparities in our country and throughout the world is something that we have to really take a look at. And GLI, we feel very proud of our programs really reflecting health disparities and seeing what we can do to increase care and advocacy for all of the people that fall into that.
Are there unique challenges for liver cancer survivorship?
I think the survivorship, one of the things with survivors that GLI talks about a lot is looking at caregiver support. I think patients oftentimes will talk about their support networks from a survivorship standpoint, ongoing treatments, medications, screenings. What does that look like long term in order to get help? How do we care for the caregivers in our life? I think that is a strong part of survivorship. Obviously, from ongoing medication and compliance to taking care of your health, we want to make sure that patients have access. How can we help patients from a financial standpoint, making sure that those costs are lower so they can continue on with that care. And really a large part of that survivorship is keeping your liver healthy. So if a transplant, for example, was something given, how do we make sure that that new liver of yours stays healthy? How do we keep on making sure that obesity or weight gain is not there, that we're eating healthy foods, that we can maintain our health long term?
Well, I wanted to just ask how GLI celebrates the Liver Cancer Month.
So the month of liver cancer that we celebrate is in October. We are so proud and grateful to be on your podcast today to highlight the great things that is happening at GLI, but really worldwide, with October being the Liver Cancer Awareness Month. At GLI, we call our Liver Cancer Awareness Month, October is for livers. We do month-long initiatives, making sure that we're bringing patient education and healthcare, our HCP world education, and really getting liver cancer to be talked about and put on the map. GLI, during our month-long campaign, we have various roundtables or webinars that we do this year, continuing to focus on health equity, raising awareness through liver health and liver cancer health in the veteran population. Incidence rates of liver disease and liver cancer are a lot higher with veterans. How do we continue to raise awareness for the immigrant and refugee population? We've done a lot of work in the LGBTQIA plus population on talking about risk factors, lifestyles, producing information and resources that help patients and also help healthcare providers become better allies for their population. Rural health is another thing. So having these webinars where from a rural health standpoint, we bring in someone from the US, we might bring in someone from rural Mexico, from rural Cameroon. How do we showcase the great work that's being done in liver, but also learn from each other, different countries, different cities, different states, so we can kind of bring back those lessons learned and help our own communities? This year, we're very excited too. Our resources are greatly important to us. We have multiple different languages. This year, we're launching Vietnamese and Japanese into our resources. Again, how do we target populations to make sure that patients or caregivers or the general population felt seen and are able to receive information in a way that they feel connected with, so we can decrease isolation. So we do tons and tons of things throughout the month, collaborating. Also great things like this. How do we get the word out there and talk about exposure, talk about risks, talk about ways to help with prevention and detection and screening, and make sure that we start talking about liver health. We feel so passionate that liver health is public health, and there's a responsibility that we all play to get that information out there.
Well, Sarah, was there anything else you wanted to then perhaps share for this episode?
We feel at GLI, we feel so proud to be the premier liver organization that focuses on patient advocacy that focuses on policy and legislation to make change. When Global Liver Institute was started, our founder, Donna Cryer, saw there being a need and gaps to fill in, especially with health equity, making sure that there was an organization that people, no matter where they lived, were able to come and get help, no matter what type of liver disease, including liver cancer, were able to find that space. I love that we can be in this area of looking at what are the needs and what are the gaps, and to be able to step in and say, this is how we can be responsible, and this is how we can show up and treat people better and expect more, and making sure that those disparities, we can help decrease those disparities, that people don't have to feel that the color of the skin or the language that they speak does not mean that they don't have access to really, really important care and education. So we're so proud to continue to talk about the work that we do. I believe that you'll also share with your listeners a lot of information can be found on our website, or our staff can take and field calls and help that way. But our information can be found at globalliver.org, and are always here to hear from patients and healthcare staff on what we can continue to do to help our liver community.
Well, thank you so much for being with us today and just being able to then talk to this important issue. And my thought is like, what a great way of being able to then talk about October is for livers.
Well, thank you, Dustin and Colin. I feel really honored to be with you guys today. Thank you for the great work that you do for our community as well.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey.
Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website at sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.